If you want to understand about psychiatry from very scratch, from the very basic, then this book is the must go to for you, called as the A Short Textbook of Psychiatry by Neeraj Ahuja. The book's front page looks something like this. So as you can see right now on your screen, this is your 20th year edition, A Short Textbook of Psychiatry by the author Neeraj Ahuja over here. Okay, now what all is included in this particular book is, as you can see on your screen, I will just scroll down below, A Short Textbook of Psychiatry, and it will tell you everything from the very basic, from the very scratch. But it is having a prerequisite. And what is that prerequisite? That prerequisite is that you have to have some basic understanding knowledge of NCERT. Okay, now this is the complete content of this book, and if you want to have this free PDF, what you need to do is simply just join the Telegram channel from the link given below. Okay, and if you want to have the physical book, then also the link is given in the description. You can have the physical book as well. Okay, so I will just zoom in, and before you start reading this book, it is having not so many images. So before going through these all 21 chapters, it is highly recommended to you that if you will read 12th class NCERT, then you will have some basic common understanding. Okay, now if you are watching this video, then most probably you are going for MA clinical psychology, as well as you are going for MPsy or M.Phil psychology, PhD psychology maybe. Okay, that depends on the scenario or your syllabus, but majorly focus you are going for the psychiatry and maybe NEET PG as well. So it depends totally upon you, but if you want to have a very basic understanding from the very scratch, then this book is a must go to for you. Okay, now first of all, you will go and from your 12th class NCERT, you will read two chapters, first on psychological disorders and second on therapies. If you have completed these two chapters from NCERT, then you can come over here in this book and you can start reading from here. Now, first chapter stands for your diagnosis and classification in psychiatry. So you will understand what is psychiatry over here, how we are going to diagnose, what are the terms and what are the conditions for that, as well as how these disorders or whatever thing there is, how this classification is done. Okay, once you will understand this, after that you will be reading about the psychiatric history and examination, how this is taken. Then after that, third chapter stands for your organic, including symptomatic mental disorders, they have given like this. And as you will come down, chapter number 4, psychoactive substance use disorders, and chapter number 5, 6, 7. Okay, chapter number 5, 6, 7 is very important for understanding of schizophrenia, mood disorders, as well as other psychotic disorders. And this is the core of your MA clinical psychology entrance examinations as well as MPhil entrance examinations. After that, you will read about the neurotic and stress related and somatoform disorders. After that, you will have understanding for disorders of adult personality and behavior. And after that, you will have these sexual disorders over here and sleep disorders. This sleep disorder is sometimes important. They can ask you question depending upon this as well. After that, you will have behavioral syndromes associated with psychological disturbances and physiological factors. Then you have mental retardation. Even if you read this, even if you can skip this part completely, hardly one or two question is going to come. That is also in a very 0.1% chance of question coming from here. Okay, now child psychiatry is important if you want to go anyway any day in future for this child psychiatry thing. Psychopharmacology, this is IMP. Chapter number 15 is IMP. Other biological methods of treatment, yes, you can read. And then we are having this psychoanalysis. This is some general basic framework given which you have read in NCRTs as well or any other general psychology book as well. Now after that, we are having this psychological treatments. Whatever you will read in 12th NCRT, just more stuff you will get in these two chapters as well. After that, we are having emergency psychiatry. This is also important. Not very much questions or not so many questions are coming from here from point 19 called as emergency psychiatry, but yes, it will be coming shortly in your entrance examinations. So this becomes also important. After that, you will have legal and ethical issues in psychiatry. This is also IMP. After that, you are having community psychiatry, and this is also good. So this is the complete overview of this particular textbook, a short textbook of psychiatry, where you will understand from the very basic, from the very first chapter to the chapter number 21st, which is your community psychiatry. Then you are having these appendixes 1, 2, 3. This is also important. Who has taken Nobel Prizes in psychiatry and allied disciplines? This is the important one. Some important contributors in psychiatry and glossary of some important terms in psychiatry. And we have seen questions coming in your entrance examinations from here as well. Okay, who has given this, who has given that, and who has given this not. Okay, things like that. And when you will go to page number 249, you will have some suggested for the reading, but you will read over here once you have completed the all the 21st chapters, I mean all the 21 chapters, and you are interested in psychiatry. Okay, you will come here suggested for the reading, and as you can see, DSM 4th edition, task force report on electroconvulsive therapy, and many more things which you will find in this particular book. But it is not at all recommended to read 18, 19, 20. You will refer so many, see, more than 50 books we are having over here, but it is not at all required that you will read go all this. If you have completed all the 21 chapters, then you are pretty much in a good condition to clear any MPhil or MA clinical psychology entrance examination which you are witnessing right in front of you. Questions are coming directly 90% of time. Whichever question you will find from, we can say, psychopharmacology or disorders or schizophrenia, mood disorders, personality disorders, are going to come from this particular textbook, a short textbook of psychiatry by Neeraj Ahuja. If you focus completely, though there are slight some mistakes in this book as well, but that is none of your concern, because the question is not coming from these mistakes. Okay, wherever the book is given wrong or they have mentioned, because it is an old edition, you have not to worry about, because the question paper is being set by those majorly who have read from this book only. So you don't need to worry, they know what is wrong, what is the incorrect information as per the recent trend. So you don't need to worry, just read the basic stuff that is. And once you will analyze the PYQs, previous year questions of whichever exam you are giving, you will find questions coming from here directly. Okay, all right. So if you are preparing for MA or MPhil clinical psychology, then this book is a must go to from the very basic, but it is having a prerequisite, and that is 12th class NCERT. If you don't have 12th class NCERT, then it is recommended that you have this book with you along with this N book we will refer to as moving forward for Neeraj Ahuja, a short textbook of psychiatry 7th edition. Okay, all right. So once you have finished this book, we will move forward to one more book called as the F book, and we will find what is about F book in our next video. I hope you liked the video, you enjoyed the video. Make sure that you hit that subscribe button, and to get this PDF free, you can just simply join the Telegram link given in the description. If you like the video, make sure that you hit that like button and share it with your friends who are giving these kind of examinations and who are interested in psychiatry, want to learn more about how things are happening, about more PYQs, and about more knowledge and stuff. Thank you and have a nice day ahead. Don't forget to subscribe and share and join the Telegram. Thank you and have a nice day ahead.